This is the FM Gold channel of All India Radio. In the program News Analysis, we now bring you a dialogue on awareness and preventive measures of cancer. The participants are Dr. Meenu Walia, Oncologist and Director, Max Hospital, and Aditi Tandon, Special Correspondent, The Tribune.
The burden of non-communicable diseases in India is on the rise. It actually is following the global pattern, and the NCDs are a big burden globally also. The World Health Organization has repeatedly warned us about the rising burden and has repeatedly also appealed to countries to formulate policies in order to control their rising NCD burden. If we look at the global figures, in 2012 about 38 million lives were lost to NCDs, and among the NCDs, as we know, Dr. Meenu Walia, cancer is the leading cause of mortality. Today is a World Cancer Day, and we are here to look at the cancer challenge that India faces. And a while ago, a study was published that told us that about 1 million cases were detected in 2012 of cancer in India, out of which about 6 lakh deaths were reported. So annually, the average deaths on account of cancer in our country is about 6 to 7 and sometimes 8 lakhs also, varying on the year-to-year basis. How do you look at the scenario of cancer care in India? How well prepared are we to handle the rising cancer burden?
Cancer is actually going to be in the coming decades a big problem for India. Even now the figures are quite scary, and as we all know, probably when what is predicted for another decade or something like 2035, they say the figures of like this 1 million may be actually be 1.7 million by that time, and the deaths also may increase tremendously. And not only is the cancer increasing, the incidence is increasing, what we actually see is the age group of the patients, the pattern is also changing in the new population. For example, something like breast cancer. From around 20 years back, we used to see majority of our breast cancer patients who used to be more than 50 years of age. So the majority used to be the elderly population. But in today's date, almost half of them are less than 40 years of age. So there is a huge chunk of patients which is around like 30s to 40s, which never used to be there in the earlier cases. So the cancer is increasing, more and more younger people are suffering from cancer. The infrastructure, whatever we have, it is not that we have, the government has been sitting silent on it. We have made a lot of progress on the front of oncology in India also. There are many new cancer hospitals. But still, whatever infrastructure we have today is inadequate to deal with the rising problem of cancer.
We have very few cancer care institutions. For instance, if we look at the national capital alone, that there are 18 private hospitals offering cancer care, and there are only 4 government institutions offering cancer care. And among government institutes in Delhi which are offering cancer care, we have the Institute Rotary Cancer Hospital, we have AIIMS, we have Delhi State Cancer Institute, and the Safdarjung Hospital. So you see, choices for the poor patients, Dr. Meenu Walia, are extremely limited. So can you talk a little bit about our diagnostic capabilities for testing? Where does a normal person go, and when does he go for cancer testing? What is it that people can do sitting at home to prevent cancer, at least get it checked at the right stage?
Yeah, Aditi, as we all know that cancer, the entire story is about at what stage it is detected. The higher the stage, adverse are the outcomes. You have higher mortalities, higher morbidity, and also the cost involved in the treatment is tremendously high. But if you detect cancer early, not only you have better cure rates, you cure the patient, but also the cost of the treatment may also be much less compared to the higher stages. And we have limitations from the government side also, because the screening programs, why there is so much of change in the cancer mortality in the West is basically because of the cancer screening programs which are very aggressively followed in the West. So the screening programs here, whatever we have in India, are not aggressive to the same extent. And apart from that, we also have to understand the mindset of the people here. Here, people generally don't have a preventive mindset. The concept of preventive medicine, I think, is going to take some years before it is actually developed in India to the same extent what is presently in the West. In West, people go to the doctors, go to the physicians for regular preventive health checkup, for preventive screening, and these are the cases which are detected actually early. Something like why the mortality of breast cancer came down. Mammography, the screening mammography has a big role to play in
So,
this.
for instance, in what particular age group do you start getting mammography testing?
We normally advise after 40 years of age. So every lady above 40 years of age should actually go for an annual mammography. That is considered as something very important to detect breast cancer early. And if there is a family history of breast cancer, then we generally recommend that the first mammography may actually be done even earlier than that, somewhere between the age of 35 to 40.
Where does a person go for cancer testing? For a layman, where are the screening facilities available?
These screening tests are not very difficult and neither are they expensive. But the fact is that most people do not walk and get these screening tests done. So screening tests are available at most of the centers. Like all the private centers, like for breast, if we talk of the screening test, it is something like as simple as mammography. And earlier than that, one can also go for a breast self-examination. But it is what the sad part will be, there will be very few ladies in India who will actually be aware that there is something called as breast self-examination. They need to do and how to do it. And they are not being educated about it. Similarly, so many years, cervical cancer had actually been the number one cancer among women in India. And cervical cancer is actually, which can be detected with something known as pap smear, which is not a very expensive test. But getting the pap smears done, people need to be educated about that to land up to a place. And these are very simple tests, not very expensive, and can be done at very small facilities also. It can be easily be done. So idea is just that somebody has to educate them. These are the tests which are required. This is what should be done and at what time to approach and get them done regularly.
Dr. Meenu Walia, coming back to the issue of what people sitting at home can do about themselves and about the fact that they can avert cancer incidents or whatever. Is there a possibility that people, if they avoid certain listed and specified risk factors, will perhaps be at lesser risk of cancer? Are there studies to this effect?
Yeah, definitely there are a lot of studies to this effect. And this is what I was coming to. Like preventive health will not only include the screening test, but earlier than that, it also includes a healthy lifestyle. And what do we mean by a healthy lifestyle or a preventive lifestyle? That will include something like avoiding smoking. We all know that more than majority, tobacco related cancers actually tune to the amount of more than 40% of the cancers. It is not only lung cancer, there are a lot of mouth cancers, food pipe cancers, cervical cancer, which are all related to smoking and tobacco. So similarly, having a healthy lifestyle, that will mean saying a big no to tobacco, cutting down on alcohol, having a good physical activity, avoiding sedentary lifestyles, taking lots of fresh fruits and vegetables. These are the things which actually go a long way in preventing these diseases, in preventing not only cancer, in many other non-communicable diseases also.
I was looking at the WHO's latest report where they map the burden of non-communicable diseases across the world, including India specific. All countries have been given these findings because as we all know that the WHO is pursuing a global target of reducing NCDs by about 25% until 2030. That is the target, and every country is being pursued to follow policies to that effect. I want to specifically come to the fact, Dr. Meenu Walia, that a lot of food that we eat these days, the quality of food that we have, trans fats, the whole debate around what is going into our body. Because the WHO has repeatedly called for cutting trans fats into foods and bring national policies on those fronts and, replace them with polysaturated fats. Is there some evidence to suggest that what we eat may also perhaps increase or decrease the cancer risk?
There is definitely evidence to suggest that what we eat is very important. And there are certain cancers which are supposed to be directly linked to fatty foods. Something like breast cancer or colon cancer and prostate cancer, where dietary factors have actually been implicated in etiologenesis. And if you recall, Aditi, there has been a lot of hue and cry about Punjab being the cancer belt. And it was also attributed to a large extent to the use of pesticides. So what we eat is very important. And one of the major factors which I personally feel is that is a reason for so much of increase of cancer in our subcontinent may be that whatever we need to ask ourselves, do we have that stringent controls on whatever is being done about adulteration in food? Like food and drug adulteration control is a very important thing.
Absolutely.
So all these things, the preservatives, the coloring agents, whatever is used in the food are in some way or the other carcinogenic.
I agree with you totally, because this is one sector which seems to be absolutely grey, and I think a lot needs to be done with respect to food and drug quality testing, especially food testing, because as we know, we are up against huge MNC lobbies, aren't we?
Yeah.
I mean, when we come to trans fats, there was a recent, intervention of the Food Safety and Standards Organization of India, FSSAI, which is the apex food regulator. And a report was commissioned by the FSSAI to test the extent of unhealthy foods being marketed in Indian schools. And this report was submitted. But then, it is a well-known fact that the government also has to balance out a lot of interests between health and industry. There's always a competition. The same goes for tobacco lobby also. And although a lot of landmark and, must I say, revolutionary changes to the anti-tobacco laws are now in the offing. Dr. Meenu Walia, specific...
May I interrupt at this moment? Just don't you think it is sometimes you sit back and you find it is so ironical that something we know causes so many cancers, something like tobacco, and we will have endless debates on this, whether it should be banned or it should not be banned. And then things like cervical vaccine. I mean, we will take ages before we actually adopt tobacco cessation, but we keep on arguing about something like a lot of controversies of something which is preventive. Like we know cervical vaccines are preventive. There have been studies to show that they are safe. I mean, in cases where you have no answer at all. So somehow as a community, we are very hesitant, we are very reluctant to adopt changes.
Absolutely. As you rightly said, that there are concerns and there are a lot of pulls and pressures which the governments also work under. Although this government, I must say, during the last budget, imposed heavy taxes on tobacco and made a lot of difference to the tobacco sales. And now they are proposing to ban the sale of loose cigarettes.
Yeah.
So I think that might help in at least curbing adolescent use. Do you think? Because a lot of these people go to kiosks and get, 1 or 2 cigarettes. You just pay small amounts. But once they have to buy packaged cigarettes, which are much costlier than loose cigarettes, it might then make some kind of a difference.
Yeah, definitely. I think it is going to go a long way. And apart from that, I think that we need to start acting at the school level. I mean, when boys, and nowadays we say girls also, they actually get into this addiction of tobacco. I mean, today morning only I saw a patient in my OPD, and this boy was 23-year-old, and he gives me a history of smoking for last 8 years. I mean, imagine, so I had to ask him that you started smoking at the age of 15. So this is what is happening. Our people, our students, our kids, they are actually in schools, they are starting smoking. So if they are adopting all these habits at this age, by the time they become intelligent enough to understand the bad effects, it's too late. They are addicted to it. It becomes very difficult to have de-addiction at that point of time.
I just had one question around the burden of cancer in India. There are concerns around the fact that we are unable to estimate the burdens correctly because of inadequacies in our cancer registry system. Do you have a take on that?
Yes, it has been inadequate for a long time because the cancer registries are very limited and at very few places. And all said and done, there will be a lot of underreporting also. Not everybody actually reaches the healthcare professional to healthcare systems where it is actually being recorded. But things are changing, and there are this recording things and even documentation and registries are also improving.
Right. Hopefully we'll have more finances in the next budget to fight cancer. Thank you.
You were listening to a dialogue on awareness and preventive measures of cancer. The participants were Dr. Meenu Walia, Oncologist and Director, Max Hospital, and Aditi Tandon, Special Correspondent, The Tribune. It came to you in the program News Analysis, produced and presented by the News Services Division of All India Radio. This program is also available on our website, newsonair.nic.in. You may email your opinion about this program at airnsdtalks@gmail.com. Please stand by for our next program, Charcha Ka Vishay Hai, in a short while from now.